What is the connection between health and wealth, not just for individuals, but for rich nations such as ours? In a major new study, the IPPR, a centre-left think tank, has concluded that Britain is getting poorer and poorer because it is sicker. In recent years, massive numbers of Britons have disappeared from the workforce, on account of being, they say, long-term sick. And Britain today is a country where life expectancy is rising for the rich and falling for the poor. What do we do about all this? Well, Professor Dame Sally Davies is co-chair of the IPPR Commission on Health and Prosperity. She's former Chief Medical Officer for England until October the 1st, 2019, and now Master of Trinity College in Cambridge. Professor Davies, good morning.
Good morning, Emil.
We discussed some of the key findings with your colleague, Caris Roberts, an hour ago. For those who weren't with us at the time, what to you are the main findings of your extensive study?
Well, I think it's pretty clear to everyone that if you're ill, it's difficult to work, and that impacts your pocket. But what our excellent IPPR economists have done is track 5 years before the pandemic and shown the actual impact on individuals. And on average, for instance, if you have chronic mental health problems, it'll impact your salary by 2.2 thousand. Now, that's a lot of money, and it's an average, and some people, as we know, lose jobs, and others, they have to change their jobs. It's about £1,800 if it's a physical illness. So it impacts us. But of course, the people coming out of the workforce or not able to work maximally are then impacting our economy overall. And if you look at the 700,000 who lost their jobs and perhaps retired if they were over 50 or became unemployed in the 5 years before the pandemic, it shows us the big impact on our own GDP and our prosperity as a nation.
Why is chronic ill health a growing problem in this country, whether it's obesity and type 2 diabetes and issues of that kind, or the mental health issues you talk about there?
Well, there are two sides to this. One is we all, as we age, develop problems, and you really need to get in and be sorted early with those problems. And of course, in part thanks to COVID, our waiting lists are rising. The NHS could do better. But then, as we know, we have structural problems in our society. Someone born now has a 25% chance of being obese when they're 21. And we know that obesity is associated with depression in its own right, more musculoskeletal problems, but also diabetes, heart disease, cancer. So what we're doing by becoming one of the fattest nations in Europe is steadily building up chronic illness and the demands on the NHS in a way that we just can't cope with as a society.
To be clear on what you mentioned economists, on what economists call distributional effects, to be clear, the poorer you are, the worse affected by these issues you are. In other words, you get a multiplier effect. So poor people have ill health, which makes them in turn poorer, which makes them more sick, and so on.
Thank you. You've explained it very well. And unfortunately, those on the lowest income, the poorest, are more prone to getting illnesses too, and may not get the best out of the NHS. So it absolutely multiplies. And that's shown as well in healthy life expectancy and general life expectancy, that the gap between the poor and the rich has grown over the last few years.
You're calling for a major new mission, a new act based or modelled on the Climate Change Act, which comes with an independent committee. Why do you see that act as an effective model here?
Well, we've had a few goes at all of these structural issues, including obesity in society, and they haven't worked. So we want to take a leaf out of the climate change book. We want a big national ambition. We want the country to sign up to being the healthiest country in 30 years' time in the world, and to extending healthy life expectancy to and beyond retirement. Well, if you're going to have a big national ambition like that, how do you embed it? You have a National Health and Prosperity Act that sets up a National Health and Prosperity Committee to make sure things happen, to ensure cross-government and cross-society activity and for accountability. But you also have to have investment, and the investment needs to be not on an electoral short-term cycle, but long-term, with the evidence provided by What Works Centre and working with the private sector on innovation. We need an investment bank for health, for instance.
But it's interesting you mentioned a few times there the word investment. You know, it feels that every day on this programme we talk about the strain on the NHS, which I know you've paid very close attention to over the course of your distinguished career. Everyone knows, as you mentioned, that with an ageing population that strain is likely to increase, and everyone knows that in both absolute and relative terms the amount our government spends on health is growing. Does a time come, Professor Davies, does a time come when you think maybe we need to be radical about how we fund our national health and look at other systems around the world? Because what's happening at the moment is more and more money is being spent, but still we have the outcomes that have led to your publishing this report.
Of course we need to have a look at how we can run and fund the NHS to give the best bang for the buck for our public. But what we from the IPPR Commission are talking about is let's look at the drivers of ill health. Let's do something about that. And that takes more than just having a national sickness service fit for purpose.
Professor Dame Sally Davies from Trinity College in Cambridge, but also co-chair of the IPPR Commission on Health and Prosperity. Thank you so much for joining us.